And even those who are expected to take care of the rest of us are susceptible to suicide. Studies show medical doctors are more likely to die by suicide than the general population. According to Medscape's Physician Suicide Report in 2023, an estimated 300 to 400 doctors die by suicide each year in America. Facing professional pressure, intense hours, and burnout, that is more than double the rate of the general population. The research says 9% of male American physicians and 11% of women doctors have reported suicidal thoughts. To discuss these alarming suicide statistics, we're joined by psychologist Melinda Moore. Dr. Moore is a leading voice working at the intersection of faith and suicide prevention. She trains clergy, faith leaders, clinicians, and PhD students on ways to combat this dilemma and how to counsel the loved ones left behind. Thank you so much for joining us, Melinda. The shorter days of fall and winter tend to be blamed for increased depression, but what are the most common causes of depression and anxiety?
Well, I mean, I think depression and anxiety are complicated, and you can't necessarily link depression and anxiety. I do want to say that with suicide. What we know about sort of seasonal depression is that it's thought to be linked with the lower amount of light in the northern hemisphere during the winter months. But when it comes to suicide, it's a much more complex cause or reason behind it.
Well, you've seen a lot of studies, I'm sure, that show TikTok and social media platforms may have harmful effects on children and families, often leading to potential situations of suicide. A Gallup study noted teens on average spend 4 to 5 hours a day on social media, hours. Do you see these effects having a link to increased suicide rates?
I know there have been studies, some large longitudinal studies of children and adolescents who spend more than 3 hours showing some pretty poor health outcomes. But, I think it's a mixed bag. I think also social media and these other resources that we get on, the phone or on the computer also provide us connection, needed connection and support. Whether it's the Hallow app or, Calm or, the UCLA Mindfulness Center. I mean, there are all sorts of wonderful apps, all sorts of wonderful opportunities for really good content also to come into our lives. When I think about children and adolescents, I think about those who are in rural communities who might feel disconnected from others. They actually get a lot of support. So I think it's an opportunity for parents to really get interested and engage with their children about the content that they're watching, that they're consuming, and also the number of hours that they're consuming it. But I wouldn't necessarily blame social media on the rise of suicide among adolescents.
I know many of us would say that they can always enjoy the content on the EWTN app. But you're
Yeah.
a person of faith, and you've mentioned this fuels and affects your work. Have you always had your faith, and did it drive your decision to become a psychologist?
Oh, definitely my faith was part of it. But, like Bishop John Dolan and Deacon Ed Schoner, I'm also suicide bereaved. It was my husband who died by suicide a number of years ago. I was working in healthcare, public health, and that his death really changed the direction of my life. I got very curious about suicide prevention and then ended up going back and getting a PhD in clinical psychology at Catholic University of America. And so it really opened my eyes to the suffering around suicide and the fact that we really weren't addressing it, not just in faith communities, but we weren't addressing it in sort of popular culture and certainly in clinical training. And so I would say this experience of loss combined with my new faith. I was a new Catholic when my husband died by suicide. I would say those two things together really fueled my current profession and my current mission to train clinicians, but also to help forward faith communities and how they address and think about and become resources and really safe harbors for people who are in crisis, but then also for those individuals who've had the worst happen, and that is to lose a loved one to suicide.
That does sound like the worst. I'm so sorry for your loss, and I know the team joins me in expressing our deep prayers for your late husband. Now, you train church ministers who work with the faithful who have suicidal thoughts. Why is that training so essential to combating suicidal thoughts and suicide in general?
Yeah, I think faith leaders, clergy, lay faith leaders of all kinds, not just Catholic, have a wonderful potential to demonstrate leadership, not just how we talk about suicide, at the funeral, let's say in the aftermath of the suicide, but also from the pulpit, how to manage mental health crises and also how to reach out for help. I think so many people of faith somehow feel like this is a moral failing or some sort of a spiritual crisis, when in fact it very well may be a mental health crisis and they just need to get some help. I talked with many, many faith leaders who knew that they really needed to be better equipped. But unfortunately, only about 70% of clergy in this country go to seminary or don't go to seminary rather. Only about 30% do. And those that do oftentimes get very little education on how to think about suicide or how to react or how to be a resource for people in their faith communities. And so I think there's a real dearth of knowledge and training, and we need to do a better job. I know that I have been involved with a number of individuals on the Faith Communities Task Force for the National Action Alliance, but I've also been part of a group of people who are really working at the forefront of faith and suicide prevention. And we've actually partnered with CAMS Care, which is a suicide-focused treatment training company. It's actually offering a virtual training for clergy, faith leaders of all kinds, not just Catholic.
Well, important to get them to recognize the signs and help people get the help that they need. NPR
Yeah.
recently featured a Columbia University psychologist who said faith absolutely affects mood and disposition, and that it makes you happier and able to cope and be more resilient. You talked about how this might be so or it might not be so. It's definitely not a moral failing to be depressed. But do you ascribe to this position of faith as a fuel for joy and happiness as well?
No question about it. Faith gives us meaning in the best of times, and in the worst of times, it sustains us. It's life saving. I know it was for me. But I think also some of the practices in faith, whether it's prayer, whether it's going to a service, these are all very life affirming and help us understand, that we do have internal resources to help us, but there are other, sources, resources external to us that can also help us. They sustain us. Prayer is a very much a meditative practice. We talk a lot about meditation in, popular culture and secular culture and psychology, but prayer is very much a meditative practice. And then, of course, when we participate in a service, we know from research, Dr. Karen Mason's done some seminal work in this area, that, it's not just the feeling of belongingness that really helps individuals who participate in a service, but it's that practice of shared values. So I think there are a number of things in a practice of faith that can help us not just sustain us, but also make us happier and more joyful, and certainly giving meaning to our lives.
Absolutely. Thank you so much, Melinda.